Hello there, my name's Tom Searle, I'm one of the junior doctors on the ward today. Can I just confirm your full name, please?
Angus Blokes.
Nice to meet you. Can I call you Angus?
Yeah, that's fine.
Nice to meet you, Angus. And how old are you, if you don't mind me asking?
26.
Okay. I've been asked to perform a back examination on you today. That'll mean taking your top off, getting you to stand up and walk, and also feeling it along the back and doing some movements as well. Is that okay with you?
Fine.
Thank you. Have you had any problems recently with your back at all?
No.
No pain at all?
No.
Any stiffness?
No.
And has it been disrupting your daily activities at all?
No.
All right. That's good to hear, thank you. I'm going to be speaking to my colleagues throughout, if that's okay. All right. So first of all, do you mind just removing your top for me? And from the end of the bed, Angus seems well at rest, and there's no paraphernalia around the bed suggesting any mobility issues such as mobility aids. Do you mind just standing up for me, please, Angus? Thank you. So I'm going to be inspecting Angus to see if there's any asymmetry to any of the joints, any scoliosis, whether there's adequate lordosis of the lumbar spine and also cervical spine, and adequate kyphosis of the thoracic spine. Also looking for any scars suggesting previous surgery or any other bony or soft tissue abnormalities. So if you just face me first, Angus, so I can see that there's no abnormality in symmetry. And if you face to your left, and from the side, lumbar and cervical lordosis and thoracic kyphosis are normal, and away from me, and there's no scoliosis of the spine, and then to your left, please. Thank you. So on inspection, there's no abnormality detected. If you don't mind just walking to the end of the bed and back for me. So I'm looking for heel strike, toe off, normal arm swing, and normal stance phase. That's fine, thank you. I'm now going to just feel down the back, if that's okay. So if you wouldn't mind just turning away, thank you. I'm going to feel down the spine from the neck. Just let me know if there's any pain and we'll stop, all right? So feeling down the spinous processes. Checking my patients and no discomfort. And I'd go right down to the coccyx. Now we're going to press to the side of the spine, checking the paravertebral muscles one at a time. And down the other side. And also screen for fibromyalgia. Is there any pain here? Okay. And I'm going to press at the base of the back, if that's okay, looking for any sacroiliitis on either side. There's no pain there at all? Okay, that's fine, thank you. So I'm now going to get you to do some movement, if that's okay. So first of all, I'm checking flexion of the back, so if you bend forward, keeping your legs straight as far as you can, that's lovely, and then stand up straight again, that's lovely. And I'm going to perform shoulders test now, which just measures there's adequate flexion in the back. So if you wouldn't mind just facing away from me, thank you. I'm going to measure a point in on the spine centrally that's at the same level as the iliac crest, so about L4. I'd mark that point. I would then measure 10 centimeters above that point, and I would ask my patient to flex his spine, bending forward as far as he can, and I'm looking for an increase of 5 centimeters in that distance. Thank you, you can relax. So the flexion seems normal. Also, if I support you, I'm going to ask you just to bend backwards as well, as far as you can. So back extension is normal, thank you. And then if you keep facing the way you are, put one hand to the side and then flex to the side for me. Thank you, that's great. And to the other side. Lovely, so lateral flexion seems normal. I'm now going to test movements of the neck. So if you put your chin to your chest for me, thank you. And then look up to the ceiling, thank you. And then put one ear to one shoulder, that's lovely, and the other side. That's great, and then if you look over one shoulder and the other shoulder, as far as you can. That's great, thank you. So all movements of the neck seem normal. Now I'm going to check the thoracic spine. So if you take a seat on the side with your legs over the end for me, and cross your arms in front of you, that's great. And if you twist your body right round to one side and the other side, that's great, so rotation is normal, thank you. I'm now going to ask you to lie back on the couch, but I'm going to have to lower the head of the bed if that's all right. So ideally I'd have the patient totally flat. Are you comfortable there? Brilliant. So I'm now going to perform the straight leg raise. I want you to totally relax your legs, and I'm going to take the weight for you, okay? So start with the right leg, keeping it straight. I'm going to lift it up slowly and seeing if there's any pain at all. Once it's above 30 degrees, that's normal, so that's no pain there, that's great, thank you. And the other leg. And again, no pain, so straight leg raise is negative. Now if I can ask you to bend at your right knee, put your right heel on your left knee, if that's okay. That's lovely, and then just totally relax your leg. You're going to stabilize the pelvis and just push down on that, okay? Tell me if there's any pain at all. No? Okay, that's great. And then if you straighten that leg out and do the same with your left knee. And totally relax for me. I'm just going to press down on that lightly. So again, no pain, so that's negative Faber's test. You can relax for me, thank you. To complete my examination, I'd like to do a full neurovascular assessment of the lower limbs. I'd also like to assess the joints below and above, so that would be the hip joint and the shoulder joints. Would you like any help getting dressed at all? Okay, the t-shirt's just there. Thank you very much. That concludes the exam. I've now washed my hands before moving to a new clinical area.